This week marks 3 years since the world started to shut down to try to stop the spread of COVID. And now there have been more than 100 million COVID cases in this country. A lot of people, some people at least, have experienced health problems that go way beyond their initial infection, a condition that's being called long COVID. And listen, let's be honest here. There is a lot that researchers still do not know about long COVID. There's a lot of symptoms involved here, kind of a wide range, and it seems to hit different people in different ways. About a year ago, our senior medical correspondent, Dr. John Torres, talked with one long COVID patient, and now he's following up with her to see how it's affected her life.
3 years ago, Shamir Smith got sick, and she still hasn't gotten better.
The body pain, the eye issues that won't let up for me, and the memory loss can be quite challenging.
She was diagnosed with long COVID, a name for a collection of health-related problems some people experience after a COVID infection. The numbers can vary, but a recent survey found about 15% of adults in the U.S. have experienced long COVID symptoms.
Long COVID can mean a lot of different things to different people. Most commonly, you'll hear people with long COVID talk about fatigue and energy issues, sleep disturbance, and some people have prolonged breathing trouble as well.
Dr. Jeff Siegelman knows what it's like to live with long COVID because he's suffering from it too.
In August of 2020, I was working in the emergency department. I woke up one morning with a fever and a headache. Now, 2.5 years later, I'm still on a pile of pills. I still can't taste my dinner or a glass of wine.
A recent study found fatigue was the most common long COVID symptom, followed by loss of smell, brain fog, and shortness of breath. Many with long COVID have had to take time away from work. When we spoke with Smith last year, she was on a pause from teaching.
I kept saying, hey, I'll be back in August of 2020. Then it became, I'll be back in January of 2021.
And now?
I actually just was approved for disability retirement from the school system here in Baltimore.
How important was teaching to you?
Teaching was the thing that I felt like I did the best. I went from a black poor girl growing up in Southeast DC to one of the best teachers in Baltimore City. I wouldn't have had it any other way. And because of a stupid virus, I spend most of my time on a couch.
Now, 3 years into the pandemic, we're learning more and more about long COVID.
What causes it seems to be some ongoing abnormalities in the body caused by the virus. There's probably some element of immune problems. There has been evidence of the virus itself persisting. Whether that causes the symptoms, we're not sure yet. And there are all kinds of other hypotheses.
And there's still a lot we don't know.
We don't exactly know how common it is. We don't exactly know who's at most risk of getting long COVID, and we don't yet know the right treatments or even how to prevent it.
Researchers like Dr. Leora Horowitz are looking to answer those questions in studies across the country as part of the National Institutes of Health Recover Initiative. With regulations lifted and emergency declarations set to end in May, it can feel like COVID-19 is over, but those with long COVID are grappling with a new painful reality.
I'm getting married in June, and I'm worried about how am I going to hide these rashes that came up about a year ago, and they won't leave.
Dr. John Torres is joining us now. Dr. John, what is it, right? I mean, here we are 3 years in. You hear her story. You hear other stories. Why is it so hard to study long COVID? What makes it so difficult?
And Hallie, if you go back 3 years and you remember, because we were all here reporting on this the whole time, is we started hearing stories of people having these symptoms 6 months, 8 months, even a year later. And it just started kind of the ball rolling, and people scratched their heads a lot saying, we don't know what this means. And after accumulating enough data, we figured out, okay, there is a long COVID component to this, but we don't quite understand it. So we're already, a year and a half, 2 years into the pandemic when we first start even paying attention to it. And then we start saying, okay, we need to study this, but long COVID has so many symptoms and each person's symptoms are so variable, it's hard to study. Even if you look at groups, men tend to have more cardiac kidney type issues. Women tend to have more musculoskeletal type issues. And so it's really hard to get a good finger on this. And it's really hard to define what exactly long COVID is. And until we do that, we really can't study it in depth, Hallie.
Super quick, Dr. John, just because like you sometimes hear things like, okay, maybe Omicron doesn't give you long COVID quite as much as the initial strains did, or maybe if you take Paxlovid, that'll help you not have long COVID. Is any of that stuff true?
That stuff could be true. We know Omicron's not as conditional for long COVID, doesn't cause as much long COVID. Paxlovid can certainly help. One of the things we're finding out is that if you have more severe illness, you're more likely to have it. Doesn't mean you won't get it if you don't have severe. On top of that, if you're vaccinated, you're less likely to have it as well. So you still need to get that vaccine, Hallie.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.